Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope that you all are well and safe and staying safe and staying home. So all this month, what I would like to do is go back to doing questions and answer shows for you because let's face it, it's getting difficult to get out there and get to a veterinarian. And so I've got a couple of suggestions for you, and I'm glad to see that there's some questions popping up already. I had a lot of questions about, guess what, the COVID virus. So there's a few things I talked about this last week with my iPets Ally group, but I want you to get this information as well. So there, the big thing is can pets transmit the COVID virus? And there are 2 dogs and 2 cats that have been diagnosed, that were living with people that were diagnosed with COVID-19 that have been reported to be infected with the virus, but they didn't get sick. And for the most part, other dogs and cats living with people that were infected remain uninfected. So it's really unknown about what does that mean? Does that mean they can transmit it to us? And it doesn't seem to be the case, but this is where if you do have the virus and you're sick, and hopefully it's a mild case and you're able to stay at home, you need to kind of think about things a little bit differently. So what I'm going to do is put some resources for you in the links so you can do a little bit more reading about the virus and pets and how that affects them. And then a lot of people are wondering, okay, there's a coronavirus vaccine for dogs. Can we use that for us? And absolutely not. It is an entirely different form of the coronavirus. And in fact, this one is what caused the SARS epidemic probably a decade ago in Asia. It's just, unfortunately, life is different now, and so the virus tends to spread all over the place. And as Jackie can tell you, I met Jackie down here in Mexico, and she had to go back to Canada because her husband needed to go to work and take care of people. But they went home and got in a 2-week quarantine because the Canadian government was being wise about restricting people's movement that had been out of the country and exposed potentially. So it is super important. If you are sick, you really, really, really must stay at home, and you must separate yourself from your family. And unfortunately, that also means potentially separating yourself from your pets. So the reason is that it's they can get the virus, maybe they can breathe the particles out, but it's unlikely that they're actually going to transmit the virus back to us. So for instance, they can get whooping cough from us, but we can't get kennel cough from them. So that's kind of how this might work. Now, the other big question I've gotten is, what about when you're walking the dog? Can your dog get corona particles on it from somebody else just walking by? And, so that begs the question, do we need to go to this extreme where, we're in all this protective gear and we tape our pets up as well? So, probably not. And here's what I'm going to say to you. Pets can get the virus on their fur, but because the fur is soft and porous, it is much more difficult for you to pick it up from your pets. Now, having said that, what should you do when you get home? Wash your hands. Wash your hands, wash your hands, wash your hands. Wash your pets more frequently, your dogs more frequently if you're walking them, just to get the everything cleaned off. If you are super susceptible and on the high risk list for getting sick with the virus and having serious complications, i.e. you are over 60, you have asthma, you've had respiratory issues in the past, then maybe it makes some sense to put some sort of blanket or something over the top of your pet that you can peel off. But if you do that, here's what I would suggest you do. have your gear on. And if you're in that situation where you're very highly susceptible, maybe it does make sense for you to put on a rain suit like that person had on, as well as your mask, as well as your gloves. So if you put something over the top of your pet to protect the virus from sort of getting in its fur, what you'll want to do is take that off your pet, put them inside without touching them, because remember, you've got gloves on with all your stuff, and then hang that thing, whatever it is, maybe it's a coat or something of that nature, up, spray it with Clorox, and then take your protective gear off inside out. Coat comes off, pants come off, hat, whatever. Take your gloves off inside out if they're disposable, or go ahead and disinfect them. Go get in the shower, because if you truly are that susceptible, you really want to wash well. So I hope that makes some sense for you. The other thing is, as I said, if you are sick with the virus, there are now criminal fines in many countries if you go out, or if your family goes out. So what you'll want to do, if it's possible, if you live with somebody else, is have them take care of the pet, the walking, the feeding, and playing. Don't share food leftovers. If don't hug and kiss on them, because as we know, some pets can pick up that virus, and we're still not quite sure if it infects people, but probably not. So out of an abundance of caution, make sure that you, keep your mask on when you're interacting with them. Wash your hands, wash your hands, wash your hands. Don't share dishes, drinking glasses, cups, eating utensils, towels, or bedding with people or pets in your home. It's just, again, out of an abundance of caution. The other thing you want to consider is if you live alone, you are going to need to stay inside constantly. And so it's important that you, have things set up for having a minimum of 2 weeks of needed essentials for your pets. So that's food, that's medications, cat litter, anything that you need. Having a way for your dog to go potty kind of by itself, whether that's, you just sort of, if you're by yourself, this is where it gets tough. You mask up, put on gloves, all of that good stuff. And then, head outside with the dog on a short leash, let it go potty, and then right back inside. So this is where it gets a little bit more difficult. So that's sort of what I've got for you in terms of, okay, what do we do now with the COVID virus? I'll put some of these resources in the comments in the YouTube video. This will go up as a blog on my website as well, so you'll have that information too. So somebody, same name, is asking, not sure who that is asking about her 8-year-old dog that has kennel cough, and is there a natural remedy for it? So in many cases, kennel cough is sort of self-limiting, but again, so this is a bacterial infection. So again, we get Bordetella pertussans, dogs get Bordetella bronchoseptica, but it is a bronchitis, and so because it is bacterial, it may be one of these things that you need to get some care or some help from a veterinarian, and in specific use antibiotics. There's the lowest gun, so to speak. The most simple antibiotic to use would be doxycycline, and that knocks it out pretty quickly. Now, if the symptoms are pretty self-limiting, then you can use things that will help kind of soften the cough. So things like elderberry syrup, a little bit of honey with warm water, things of that nature. So, for a good rule of thumb is that if the average person is, say, somewhere around 150 to 175 pounds, using 1/10 the dose of many of the natural remedies for your pets and working up towards full adult dose at about 75 pounds of body weight for a dog is a good rule of thumb. Most of those things are, again, there to help suppress cough. This is where often I would use things like Robitussin, just the plain stuff with guaifenesin, because it does a couple of things. It doesn't suppress the cough so much, but it helps move the mucus out of the chest so that the infection gets over more quickly. And the other thing is that the AVMA and the FDA have relaxed the rules so that veterinarians can now do telemedicine with you for your pets. And what that allows us to do is talk to you over the phone, over the video, however that works out, and listen to what you've got going on, and then, if needed, write prescriptions, that sort of stuff. So in that spirit, that's where I can be of help to you right now as well. So many of you know I do consultations, and when I'm doing that, it's generally for people with pets with chronic disease, or they want to get some sort of a health program put together to prevent disease. But if you need help and you're at home, many of my colleagues, bless their souls, I mean, they are in there still trying to work. They're having to limit how they see patients by asking you to come to the clinic, stay in your car. One of the nurses or technicians will come out and get your pet from the car and then take it inside, and then you and the doctor would have a conversation over the phone or via text and get your questions answered and find out what needs to be done for your pet. So that becomes more time consuming and cumbersome, as you can imagine. And as the number of cases in the United States continue to climb, I think this morning they're over 330,000, and now they are estimating that there will be something on the order of 1.5 million cases of coronavirus in the United States. It's going to come into more shortages of care, so to speak. So, as many of you know, I have a product available, a subscription service called iPets Ally available. I'll put a link to it here. And what that is a video library of every video I've made, and we are in the process of uploading not only audio files, but also written transcripts. And there's a way for you to kind of search through them and make notes. The other thing I want to do to help support you in this time is I'm taking literally $100 off of my normal consult fee. So if you are at home and you need help and you need some prescriptions for your pets, whether that's conventional medications or supplement plans, diet plans, for $50 you can get a 30-minute consultation with me. And again, because the AVMA and the FDA have relaxed their telemedicine rules, I'm able to actually prescribe for you in many cases. So that's what I have for you today. Does anybody else have a question that I can help you with your pet? So again, all month I'm going to be doing question and answer series, and through the month of April to help you out,